We have to ask ourselves, do we have efficacy? Do we have safety? Do we have durability? Is it effective? Is it long-term? And is it biocompatible? And I think that you're going to see, both on these studies and what Rhoda's presented to you, this pretty well does fit that bill. But you've got to change over your thought process, and that this isn't a quick, easy, wipe a little makeup off, use an alcohol sponge, and shoot a needle in. Think of it as an injectable implant, and you have to go to a little more of a fastidious nature. You need to be sure that the patient has been sterilized and truly is clean on their face, and you're not introducing a bacteria into the implant. Now, I'm sure that we're doing this with some of the HAs when we inject them, but because they're not longer lasting, we can get away with it. You're not going to get away with it with a long-term implant, but the results are well worth it. The 12-month clinical study, double-blind, randomized, 2-to-1 Aquamid to Restylane. Again, this is percentage of subjects improved by subject evaluation at a period of optimal treatment. Again, 96 to 100% got optimal treatment. You can see at 6 months, close to 90% were maintained at optimal treatment, and this is both for Restylane and Aquamid, which is what we would expect. But at a year, we're already seeing some decline in the Restylane package, while Aquamid has remained its improvement throughout the 12 months. Now, we look beyond at 24 months. We don't have Restylane figures for 24 months, but we know what happens. But here, the Aquamid still maintained its GAIS over 90% of subjects with similar improvement up to 24 months. So this is 2 years statistics. Other studies have it beyond. Some of the patients we've looked at baseline, 12 months, 24 months, no change. But you know what? I think one of the remarkable things is that the feel of Aquamid, and you think of a permanent filler, our prejudice is to feel and think of something stiff, something hard that's going to soften up. Aquamid is soft from the get-go, and it's remarkable how bio-integrated it is, even the very beginning. So it's soft, it's pliable, but it has that maintenance, and I think it's because of what you heard, the integration of the product into the tissue, where it really becomes a scaffold for normal tissue to grow into, so it has that biocompatible, very nice feeling. The first 2 weeks of injection before it's integrated is a period of time we've got to be very careful that there are no other non-sterile procedures done around the area, because it's at that time there's a risk of the possibility of infection, and that's what we should look for. So in the US study, there's no long-term complications. There were some. There was one early infection. It was caught because there was some redness and there was some inflammation. They were immediately put on antibiotics and resolved. And one late infection. When we get an infection, I think it truly has to do with the fact that bacteria was introduced. And that's why I really must emphasize that you have to be a bit more fastidious with a long-term implant rather than just injecting a filler, as far as sterility, cleanliness, and your care of it in that first period of time. But it's well worth it to the patient to understand that because of its long-lasting attributes.